Okay, so this video is going to show you how to set up your sterile field in the way I do for my practice. It's very orderly and helps with easily locating the things that you need next. So on our sterile field we have our fenestrated drape, which will cover the whole patient, our PICC kit, a sterile ultrasound probe cover, some gauze and some towels, our dressing, our small syringe for our intradermal injection, plus a 25 gauge or smaller needle for that intradermal injection, a positive pressure bung, and some kind of drawing up needle. So what I'm going to do is I don't need my dressing till the end, so I'm going to tuck that at the back there. I am going to peel off the protective cover from my PICC kit and either pop that on a bench next to me or pass that off to my assistant so that I don't have that cluttering my field. Now the stat lock we don't need till the end either, so we'll tuck that back there. I am going to need my syringe to draw up the saline aseptically from my assistant, and then you would also, using the same drawing up needle, draw up your lignocaine from your assistant. You would also get some cleaning solution. Now it might be liquid chlorhexidine 2% and alcohol 70% if your patient's not allergic, and you could just use some swabs. Some places have lollipop cleaning sticks, so if that's the case, then you could use your plastic tray as your sharps management. I'm going to use it for both. I'm going to use it for my chlorhexidine first and then for my sharps management once I've cleaned the patient. So I'm at a point where I can get my lignocaine and saline from my assistant, and then we'll proceed with setting up the rest of our trolley. So I've drawn up my lignocaine in the small syringe and saline in the big syringe because we are unable to label our drugs on this particular trolley. So our small syringe will have our intradermal needle primed and ready to go. So just give that a squeeze, and our saline is going to be attached to our bung, and then we're going to attach that onto the end of our PICC line. So we've just removed the protective cap. Find the end of your PICC line, attach your syringe onto the end, and then as touching the PICC line as little as possible, flushing it to make sure that it's fully flush with saline. At that point, I can disconnect my syringe, leaving the bung attached, and I can again put my syringe with my stat lock and my dressing because I'm not going to need that till later. Now I have my intradermal injection ready to go. I've just loosely popped the cap off that so that I can handle that with one hand. Next up will be my needle that I'm going to access the vein with. Again, I've just loosened that so that I can access it with one hand. One hand will be maintaining your ultrasound on your patient. What goes after the needle is your wire. Now remember, this is your hydrophilic wire, not necessary for a modified Seldinger technique. This wire here, the one with the blue round end, this is your modified Seldinger wire, so that goes after your needle. So in order of events, you have intradermal injection, cannula to access the vessel, wire to put down the needle as your modified Seldinger technique. Then you'll expose your sharp and make a nick in the skin, retract your sharp and put it in a sharp zone. And then you'll need your introducer dilator again, which I've just loosened off the protective covering, with your PICC line primed and ready to go. So at this point, you can take some swabs, get your solution, clean the posterior of the arm, unwrap your fenestrated drape, and then using the outer wrap from your fenestrated drape, you can tuck that underneath your patient's arm, making sure to dispose of the swab or stick that you've used to clean the posterior of the arm. New swab or stick to clean the anterior of the arm. Make sure you allow that to dry. and then you can remove the adhesive coverings and apply your drape to your patient's arm. So that's how I set up my sterile field. So it's all ready to go in a logical order, and the things that I don't need till later are tucked away at the back so they don't get accidentally contaminated or thrown off my trolley.